Hi, my name is Congenital and you're watching the video Introduction to Mechanical Disorders of Ocular Movements. In this video, I'll do a very brief introduction regarding mechanical disorders and specifically focus on the types of causes of mechanical disorders and some of the key features of these particular conditions. So mechanical restriction interferes with the free movement of the eye. And the limitation that we see on eye movements is due to a mechanical force rather than a neurogenic force. So far in this subject we've learnt about the variety of conditions that are neurogenic. We're now moving on to the conditions that are limited, that cause limited eye movements due to mechanical restrictions. These, as with neurogenic palsies, can either be acquired or congenital. As an example, let's have a look at the child here at the bottom. And what we can see is that the child is in dextral elevation, and we have a limitation here of the left eye in elevation. So there's two things, or one of two things that can be occurring here. Either we have an inferior oblique that's limited, so we have an underacting inferior oblique and an inferior oblique palsy as such, or it could be that the eye is limited in elevation because there is a mechanical restriction. So our duty as orthoptists will be to determine where we see limited eye movements, whether the cause is neurogenic or mechanical. Let's talk about etiologies or the causes of mechanical restrictions, and we'll commence with acquired mechanical restrictions and then we'll move to the congenitals. One of the causes is trauma. So where you might have trauma to the eye, and this might include, as an example, a ball hitting the eye, or for instance in a motor vehicle accident, the patient might come forward and hit their eye against a steering wheel. They can cause soft tissue injury or bone injuries around the orbit. With soft tissue injuries, you'll get swelling and edema and hemorrhaging, and then with resolution, sometimes there is scar tissue that remains. This scar tissue can cause an inability of the muscle to relax or stretch, and therefore what we'll end up seeing, or what you will end up seeing, is a mechanically restricted eye. Now, soft tissue injuries without even scarred tissue at the beginning can cause limited eye movements as well, because you have a lot of swelling around the orbit and this can limit the eye movements. However, in this instance, what you'll see is improvement of the eye movement as the soft tissue swelling and so forth subsides and resolves. In terms of bony injuries, if there's injuries to the actual bones of the orbit, we will also see, or we may see, entrapment of tissue or muscle, or there could be displacement of the globe, and all these will cause limited eye movements. We'll talk more about this in subsequent videos, specifically related to bony injuries or orbital injuries. Over to the right here, just quickly, we can see a patient here who has swelling of the eye. It doesn't look too bad there. It may be that this has started to resolve, and the patient is looking up, and we can see that there's limited eye movements here in elevation. So this patient has had trauma to the left eye, which has caused limited eye movements in elevation, and it's mechanical in nature. And we don't know, through looking at the photograph, whether we have bony fractures, whether there's trapped muscle, whether the limitation is due to soft tissue injury, etc. That's for further investigations. Other causes of mechanical restrictions is inflammation of or inflammatory disease, or secondary to myogenic inflammation. So we'll talk about this more when we get to myogenic inflammations, or specifically thyroid eye disease, how this condition can specifically result in a mechanical restriction. Space-occupying lesions within the orbit, so a tumour within the orbit, can cause limited eye movements, and these generally are mechanical in nature. If we look at the image here to the right, we can see that there is a space-occupying lesion here, and it's actually compressing up against the optic nerve as well as compressing on the lateral rectus here. So this in and of itself will create some issues in terms of eye movements. Retinal detachment surgery can also cause mechanical restrictions, and specifically we're talking about scleral buckles, or when scleral buckles are used in retinal detachment. In this image here, we can see a scleral buckle that's been put on the eye, and you can see how close that is to the extraocular muscles there. And what can happen is limited eye movements can occur from edema involving the orbital connective tissue, conjunctiva and extraocular muscles. Or what can also happen, post-operatively adhesions are formed with the extraocular muscle and the scleral buckle, etc. And we end up having restricted eye movements. The buckle itself could also trap a muscle, in which case this will cause a mechanical restriction. Another reason we could have a mechanically restricted eye is iatrogenic. So you may recall in talking about superior oblique palsies, we talked about the fact that if a superior oblique tuck is performed, this can cause a limited eye movement in the opposite direction, so in elevation and adduction. This is iatrogenic, where you're creating a limited eye movement due to surgical intervention. Okay, let's move on to congenital mechanical restrictions. There are a number of congenital disorders that lead to mechanical restrictions, and I've listed several there. We've got Drain's retraction syndrome, Brown syndrome, strabismus fixus, adherence syndromes, and fibrosis syndromes. Our focus in this subject will be the top two there, Drain's retraction syndrome and Brown syndrome. These are the most common, and the most common that you'll see in the clinical environment. And we'll talk more about them in some subsequent videos and what causes these particular conditions. And finally, let's have a chat about some of the key features of mechanical restrictions. Now, the list here, all the features that we see here are not necessarily going to be a part of one condition, but these are some of the things that are representative of mechanical restrictions. So deviation, in terms of the deviation, often we'll see reversal of a deviation. So in up gaze it might be a right on left, and in down gaze a left on right. Now you know already that this can occur in other conditions such as bilateral force, so it's not a definitive test, but it is an indicator that you may have a mechanical restriction. The deviation in primary position also may not correspond to the size of limitation. So you may be seeing a -3, for instance, limitation, and that usually causes a deviation in primary position, but you may see the eyes are relatively straight or maybe even straight even though you have a -3 limitation. This generally indicates that what you have present is mechanical and not neurogenic. In terms of the muscle sequelae, this is generally limited. You're not going to see a full muscle sequelae in a mechanical restriction. At most, you'll only see the contralateral synergist overacting. In terms of the eye movements, more often than not always, but more often, it's generalised, so you don't tend to see restriction in dextro depression, for instance, but rather you tend to see it along the entire depression. Again, there are exceptions to that, but that is one of the general findings of mechanical restrictions. In mechanical restriction, we also often see downshoots and upshoots, and we see this more often than we do in other types of conditions. The ductions, you know, will be equal to the versions because the restriction is mechanical and not neurogenic. The forced duction will be positive. Saccadic velocities will be normal. We also may see globe retraction, and again, the mechanical forces at play can retract that eye on eye movements. And intraocular pressure. Intraocular pressure can raise when the eye is being moved in the opposite direction to where the restriction actually is. Okay, that brings me to the conclusion of this video. Thank you for watching.